be there, but there's so much traffic. There's so much traffic at West Croydon that a bus took ages coming around. There's something happened, and an ambulance was parked up. But anyway, I got there. I got there just after my auntie mum left, so um, I went straight to HDU, and I knocked on the door. And while I was visiting, I was always, I had my phone with me. I was making recordings because I wanted to see who says what happens, everything. Because I'm so forgetful, I don't trust myself to remember all the information that I'm being given. So I make recordings so I can, talk, show it to my dad, show it to my auntie mum that this is what was being said while I was there. This is what's happened. This is what's going on. Everything was being documented. So I've knocked onto the HDU door now, and I've been waiting there, ringing the bell. They're supposed to be working. Um, so a few minutes went past. The door came open, and I said, "I'm here to see my father, Mr. G Hussein. He's just over there on the bed to your right." And she went, "Oh no, he's just been moved." I said, "No, no, he was right there." He said, "No, no, no, he's not there now." I said, "What? He's not there now? He's really been moved?" He said, "Yeah, he's just been moved." So I said, "How long ago?" She said, "Just now, maybe 3 minutes ago they took him." I said, "Oh, okay, so which ward have they taken him to?" She goes, "It's gone to Fairfield 1. I said, "Fairfield 1, where is that?" She goes, it's on the first floor. You have to go to the first floor, and then there's directions there to Fairfield 1. I said, "Okay." So gone there, asked a couple of people which way to Fairfield 1, just pointed me in that direction, lift there, catch the lift down. I said, "Okay." Got the lift down, looked on the board where Fairfield 1 is, followed directions, got to Fairfield 1 and 2, went through there, Fairfield 2 this side, Fairfield 1 on the right. So went up to reception now, and there's lots of nurses and men nurses, women nurses, and a couple of doctors, and they're all laughing and giggling and so on. And then I said to them, "Excuse me, I'm here to see my father, Mr. G Hussein. He's just been brought down from HDU. Can you tell me where he is, please?" And the two of them behind the desk, they go, uh, uh, we don't know who's who. We're still doing a shift change. We just changed shift, and we don't know who's what and who's just come." And she goes, "Nobody's come here." I said, "Yeah, they've just brought him from down from HDU. So you should know that there's somewhere. If a patient's come down from an emergency HDU, you should know where is he." So they've gone, has a patient been brought down? Anyone? Has patient come down from HDU? No, no. Oh no. Okay, so you're gonna have to wait half an hour before we finish and we find out what's going on. I said, "No, I'm not gonna wait half an hour. I want to see my dad." And where is he? So I said, "Oh, okay." So another Asian nurse comes in from the ward in the right side. So she goes, "Oh, I've just settled in Mr. Hussein G." And then I said, "Yeah, that's him. Yeah, where is he, please?" And she pointed in that direction. I said, "Right, I'm coming. I'm gonna go and see my dad." And then I just ignored everyone that was trying to stop me. I went to followed directions, went to see my dad. She said bed 4. I said, "Okay, bed 4." I went to see bed 4. Bed 4 was written there, and there was um, a male nurse that was just settling my father in and putting his stuff on, stuff away, and just walked up behind him. I said, "Oh, hi, hello, Dad. Assalamualaikum. How are you?" He went, "Oh, hello, son. Hello, my son." And then the nurse turned around. He goes, "Oh, I didn't even realize you were standing behind me." I said, I've just walked here and I've just stood here before you turned around. I went to HDU, and then they said they just transferred him here, so I've come straight down, and now I'm here." So they've said, he said, "Oh, okay, okay." So yeah, sure. So he's done what he's doing, packing Dad's things away, and then got the chair there, and he says, "You can have a seat." And then I sat down, and Dad said, "Move your chair that way so I'm facing my father, and he can see me." So I, faced the chair facing him, and then sat down. And then he asked me, "How are you? How's your day been?" Everything went well. Yes, all that. And then And he goes, "Oh, I need." He's got two pillows underneath his head, so he needs one more pillow. He said, "I need one more pillow to just, so I can see you. I can sit up a bit." I said, "Okay, I'll ask him." So he came round again, and I said, "Excuse me," and he goes, "Yes," and he goes, I said, "What's your name?" He goes, "My name is Sam." I said, "Okay, hi Sam." I said, my father's asked for a pillow, so can you possibly get him another pillow?" And then instead of saying yes or no, he says to me, "If you look around, some patients have." I said, "Don't tell me what some patients have. I don't want to know about other patients. I just want to know whether you can give him a pillow," which is what my father's just asked me and requested me to ask you. And that's what I'm doing. I'm asking you. And my father's asked for a pillow. So can he have a pillow, please? And he goes, "Well, this is what I'm trying to explain to you, that some people have one pillow, some people have two pillows, some people, that there's no pillows." I said, "What do you mean? I don't want to know about other people. I want to know whether yes, you can give a pillow, or no, you cannot give a pillow." And he said, "Well, this is what." I said, "Look, just be straight with me. Don't wind me up. Just give me a straightforward answer, please." He's like, if this is what I'm saying, sir, if a pillow becomes available from another patient, I will bring that and I will give it to your father." I said, "Hold on a minute. You're going to take a pillow from another patient's that he's put his head on, and you're going to put that in underneath my father's head?" And he goes, "That's what we can do." I said, "Do you know what? Don't worry about it. Don't worry about it." So I told my dad, "Don't worry, Dad. They can't. They don't have an extra pillow because they said that two is the maximum amount of pillows they can give per patient." So he said, "Oh, okay, okay. Then just lift my bed up a little. Push that button and lift it up, so I can at least see you, eye level." I said, "Okay, Dad." I pushed the button and lifted the bed up a little bit so he's able to see me, see my face instead of just facing downwards at my feet. So he's so I said, "Is that better, Dad? Are you okay?" He said, "Yes, yes, that's better now. I can see you." Okay, all right then. So after that now, um, 20 minutes go past, 25 minutes go past, and my dad's saying, "Oh, can you ask them for painkiller because I'm in pain, I'm feeling pain." I said, "Daddy, don't worry, your anesthetic's still wearing off because it was a long operation, and you getting to feel the real, um, don't worry, but the pain won't last. It's just while you're here, and then it will get better, Daddy. Don't worry, everything will be okay." He says, "Okay, can you ask them for painkiller?" I said, "Don't worry, I asked them for painkiller. They said they're doing changeover. As soon as it's done, they're gonna come and give. The nurses are gonna come and meet all the patients, and they're gonna see all the patients individually and sort everything out, all the medication and everything." I said, "Okay." So down a few more minutes go past, and my father, there's nothing, no water or anything on his table. So he says to me, "Fine, I'm feeling thirsty. My throat is drying up, and I'm finding it hard to breathe. I need water." So I said, "Okay, don't worry, Dad, I'm gonna get it." He said, "Don't worry, you stay there. You can't walk much. You stay there. So don't worry. The nurses will come." I said, "Yeah, but you need water, Dad." So I'm calling the nurse. I said, "Nurse, hello, nurse. Can you bring some water for my dad, please?" "Oh yes, don't worry. As soon as the shift is finished changing, we will bring everything. We will bring the water and medicine and everything." I said, "Okay." So it's not going to be long. I sat down again, and Dad said, "I said, Dad, they said it's going to take another couple of minutes." He said, "Okay, don't worry." Um, and then another few minutes passed, and Dad said, "Nurse, nurse, nurse, please help me, please help me. I need water. I need water. I can't breathe. I can't breathe. Please, I need help." And he's calling out like this, and my heart broke. I stood up and I turned around. I said, "Nurses, can you please hurry up? Bring my father some water. Hurry up!" And then the patient next door, the Bengali guy, he said, "Oh, so here's my jug of water. Offer me his jug of water," because he could see my father's health deteriorating so quick. He says, "Give him some water. He's getting ill." I turned around, I see one nurse holding a glass, another nurse holding a jug, and they're just walking like this. They got plenty of time on their hands. I said, "Can you hurry up, please? Can you not see he's getting sick?" So they hurry up, put the glass there, put the jug there. I poured some water into the glass, and And I fed my father the water, small sips, and wiping his mouth down. I said, Dad, are you okay? Can you breathe now? He says, Yes, son, thank you. If I didn't get water, I was struggling. I said, Hey, Dad, this is where you just sip it slowly. Don't rush. Sip it slowly. Sip the glass slowly. And I'm wiping the water down. He's sipping it slowly, just wiping his face down and holding the dish here and feeding him the water. So they did that, and I said, "Don't worry, Dad. Um, do you need more water?" He finished a whole glass of water. He was so thirsty. Then I poured some more. I said, "Dad, would you like more?" He said, "No, not yet. I want to have painkiller. Then I will have medicine." I said, "Okay, Dad, don't worry. I'm here with you. Even when they come, I'll be here with you." He says, "I'm feeling so much pain because of the catheter was causing him a lot of pain. The the stoma bag that was attached was really feeling uncomfortable for him, and because while the stoma bag's connected, he cannot feel um, the need to go for the number two, so he will pass number two without him knowing. It just needs they need to keep an eye on the bag, and for urine now, he will get the feeling that he needs to urinate, but the catheter is causing him too much pain, very very sharp pains. Um, so there's a special gel that they use to cool down the sensation of pain, to numb it a little bit, and then once that wears off, the pain, sharp shooting pain, comes back. So that was given to my father, and he was like, he was calmed down. He felt feeling a little bit pain relief. Um, and then after that, he fell asleep. He was starting to fall asleep. He said, "Talk." I'm talking to him, and he's listening to my voice, and he's just starting to doze off. And then still making a recording until my phone just making recordings on it. Sometimes it becomes too hot, and then a little notification comes up on the phone where it says temperature too hot, wait a while for it to cool down before you can use it again. I said, okay. So I put my phone away, just let it cool down a bit, and just sat there with Dad, just looking at him, listening to him. If he needs anything, I said, Dad, do you need any more water? Do you need anything else? He said, no, it's okay, I'm okay. So I said, "Don't worry, Dad. Just say prayers. If you're feeling too much pain and it becomes unbearable, just say some prayers. Just keep repeating the prayers in your mind, in your mouth, and that would, inshallah, bring the pain level down because your mind is concentrating on the prayers. So don't worry, everything will be okay, Dad. This pain is not going to be forever. Your body will be able to heal, and the catheter will be taken out. And don't worry, you'll be home soon. You'll be much much better. You will heal up. You're already doing so well." And then the next day when I came, that night, he fell asleep, and then I asked the guy next door, the Mongolia guy. I said, "Look, it's my father. He knew me from when I used to work at my uncle's halal meat butcher shop." Um, he recognized me. I explained my father's situation. Just had a major bowel cancer operation and this and that, and he spoke Urdu as well. So I said to him, "My father, his English is not very good, but when he wakes up, please give him a bit of company." And he goes, "Don't worry, I know you. I know you. Don't worry, I will, I will look after him. I will speak to him, and I will keep him busy and give him company." I said, "Oh, great, thank you so much. I really, really appreciate it." And then that's when we had so many discussions. We talked about so many things, and the previous day we talked about so many issues about what his wishes were, that if something happened that he wanted to um, be laid be left to laid put down lay him down next to his mother's grave, and that's where he wants to be, abroad in Karachi, and that's his homeland, that's where he was born. and to make sure that I took him there. If anything happens, that's where he wants to return. So there were so many things, and he says, I want you to settle down. I want this to happen for you. I want you to be happy. I've always wanted this. Don't worry, Dad. Everything will be okay. You just concentrate on yourself, and everything will be okay. We will take care of everything, Daddy. Don't worry. We're here for you. We'll always look after you. You're never gonna be on your own, Daddy. Don't worry. He said, okay, okay, son, okay. So after having that chat, he um he started to doze off, and I said, Dad, I'm gonna go. And then he was like, I said, Dad, I'm gonna come tomorrow and visit you, okay? So I kissed him on his head, kissed him on his cheek, and then I said, don't worry, Dad, I will see you tomorrow, okay? And then I said to the other patient, I'm going now. Please keep an eye on him. He said, don't worry, I will talk to him and keep him company. And I said, thank you. I'm gonna come tomorrow, and I will see him tomorrow. He said, okay. He said, bye, Allah Hafiz, bye. And so I obviously, just left there, and then I came out of there, and I called my auntie mum, and I said, this is what's happened, and this is what's happened. And I've stayed there for a lot longer, and I stayed there until he fell asleep, because I didn't want to wake him, to let him know I was going, because he was in so much pain. I didn't want him to wake up and then go through the same pain and have difficulties again. So I thought, okay, he's sleeping now, he's at peace, let him sleep. I don't want him to feel pain. So I'm going to go now, because they keep asking me to leave. So I'm going to go now, and I'll come back tomorrow. So I left, and then I called Auntie Mum, and I explained to her that, this is what's happened, and he's fallen asleep. I didn't want to wake him because I don't want him to be in pain again. So the other guy next to him, he knew me, so I said to him, please give him company and speak to him in Urdu, and keep him, I don't want him to be left on his own. So he said, don't worry. So she said, okay, thank you for doing that, and then thank you for letting me know. I said, no, it's okay, and then don't worry, I will give you a call when I get home. So I did. So I got home, and then I called Dad. I said, you're okay, I'm at home now, just to let you know. And he said, yes, son, thank you. Okay, so he spoke to me, I spoke to him, and then he said, I was just dozing off. I said, okay, don't worry, Dad, I'm coming tomorrow. So yeah, that night passed, and then the next day I had to take my youngest son to his eye optician's appointment in the same hospital, Croydon University Hospital, in the Moorfield section up on the first floor, or the second floor, I think it was, can't remember. But yeah, he had his appointment there for 2:45, 3:30. So we got there early, and then after these appointments, and because my son's got inflammation on the inside of his eyes and in the front of his eyes, where he gets blurry vision, and his eyes went completely red for so many months. So he's having to use eye drops into his eyes, which give him blurry vision for a while afterwards, and he needs to continuously use them to calm the inflammation down. Sorry. So I said to him, you know what? After this operation, your granddad's in the same hospital, so we'll go and visit him. We'll take him. We'll go and see him, both of us, and he'd be really, really happy to see you as well, because he haven't seen you for a while now, since he's been unwell. So yeah, he said, yeah, I would like to see granddad. I said, okay, don't worry, we'll go. So just before we went, I found out as we was about to leave to go to see my father, I called up to find out my father's condition. And they said, yes, he's in a stable condition. He's well. He's being monitored. There's nurses. Has he what's the condition? Yes, everything's good. He's recovering well. He's doing really well. So I said, okay. They was talking about giving him food, so he said, yeah, I think that today they started light foods on him, soft foods. I said, oh, has he started eating? She said, yes, he's I think he had porridge this morning. I went, wow, oh, fantastic, that's great news, because he hadn't eaten for the last 6 days or so. So yeah, that's brilliant. Okay, so I'm gonna come and see him soon. I'm just in hospital. My son's appointment at Moorfield in the same hospital. I'm gonna come and see him. So she says, "Oh, okay, you're just gonna be here." I said, "Me and my son coming. He wants to see his granddad." So okay, only because your mother called earlier and she was gonna come down. I said, "Yeah, she's gonna come down as well." So she said, "Oh no, only one of you can come down. Two of you can't come down the same day. We only allow one visitor for one patient and only for 15 minutes visits." I said, "But in HDU, in the other emergency ward where he's just come down from, we were both allowed to see him, but we took it in turns, not at the same time, but we were both allowed to see him on a daily basis. So I'm going to come down, I want to see my father, and my mum's going to come later and see him." She said, "No, we won't be able to allow you. If you come down now, we'll have to turn your mother away." I said, "No, this can't be right. I have to see him. My son wants to see his granddad. We have to see him. Sorry, sir, we can't allow you." So I still went to the ward, and they didn't let me see him. They didn't let me. They turned me away, and they didn't let me see him. So we left there, and I called my auntie mum and I said they wouldn't let me see him because they're giving me this excuse now. And she said, "But we was allowed to go and see them in the other emergency ward where they're even more stricter." I said, "I know, but they're not allowing me to see him. I went there with Adnan, I went there with my son, and they wouldn't allow me to see him. And this is the rules. They're saying that this is what the rules they're following, and they just didn't let me go." So what I'll do is that I will go and see him tomorrow, Auntie Mum, but you can go and see him this evening, because they said to me, if I came to see him now, then you won't be allowed, and I don't want you not to see him. You have to see him. You're his wife, and he really really needs you. So you go and see him today, and don't worry, I will go and see him tomorrow. Okay? And she said, "Okay, that's okay. All right, thank you. All right." So then I called my mum up. I let her know what's happening and everything, and then she said, "Okay, okay, I'm coming home now." So I brought my son home now, and later on, as I was coming out of hospital, my auntie mum was coming into the hospital, so we sort of crossed paths, and then I said to her, "Please say sorry to Daddy, because every day I come to see him, but today they wouldn't allow me to come to see him, and please, please, please say sorry to him and let him know I'll come and see him tomorrow. I'll give him a call once I get home." She says, "Okay, don't worry. I don't know why they wouldn't let you see him. We see him every day, and why they're being horrible to us." I said, "Don't worry, Auntie Mum. You go and see him now, because he needs you, and he's got no one with him. So I'll come tomorrow and I'll speak to you when I get home." So once I got home, settled myself down. I gave him a call, and it was just before 7 o'clock in the evening that I spoke to him, and I said, "Oh, hi, Dad. Assalamualaikum. How are you? You all right?" And he goes, "Yes, yes, your auntie mum is here with me." I said, "I know, I spoke to her." And I said, "Sorry, Dad, I couldn't come to see you. I came, but I wasn't allowed to come into the ward to visit you, because they said if I came, then auntie mum can't come." So I said to auntie mum, "Don't worry, you go today, and then I will come tomorrow." He said, "Oh, okay." They said, "Okay, all right. All right, my son." I said, "All right, but how you been? You been okay, Dad? Everything okay?" He says, "Yes, son, everything okay." I said, "Did he have anything to eat?" He said, "Today I eat. They gave me cornflakes in the morning." I said, "You had porridge, cornflakes?" He said, "No, I want to have porridge tomorrow." I told them I want porridge tomorrow. I had cornflakes today. And I said, "You ate today? Well done, congratulations, Daddy. You see, you're getting well so quickly that now they've started you on food. So soon you will be home in the next few days. Don't worry, Dad. You keep on being strong like this, and you'll be home soon. So don't worry, everything's going good." And then he says to me that later on during the day, I said, "What else did you eat, Dad?" He says, "Later on, they gave me some halal mincemeat in a tub and that in a packet." And I said, "Did you enjoy yourself, Dad? Was it nice?" He goes, "Yes, it was nice. I finished everything." I said, "I know you must have been really hungry, Dad. Don't worry." And then he says, "Now they've recently just given me some vegetables and stuff to eat." So I said, is it nice, Dad? Did he like it? He goes, it's very nice. I enjoy it. I enjoy it. And he said, don't worry, Dad, because I couldn't come to see you tomorrow. I missed you, so I will come and see you tomorrow. Okay. She said, okay, okay, my son. See you tomorrow. And I said, I love you, Dad. See you tomorrow, okay? And then I'll put the phone down. And then and then in the morning, I woke up. I think it must have been around 7:30ish. I woke up all of a sudden being sick. I, I mean, I was having difficulties sleeping because of my chronic illness and so much tension for my dad's recovery. So worried for him. I was I was vomiting. I was being sick, and I just couldn't understand why I was being sick. And then as I cleaned myself up and went and sat down, my auntie mum called me and she said, and I've just received a phone call from hospital and they're saying that something's happened to your father and they've asked me to come to hospital. Please come, please hurry up. I said, don't worry, Auntie Mum, you go, I'm coming. I'm going to phone them now to find out what's happened. I phoned the hospital and I asked them what's happened to my father. They said, we can't tell you. I said, I want to know what's happened to my dad. I've just received a call from my mum to say that you've called her in. What's happened? Tell me now. And they've said, they've gone off and they've come back and they've said, your father's stopped breathing, so they're just trying to resuscitate him now. So I just grabbed what I could. I left the house, got to the hospital, and my auntie mum called me as I was just a few minutes away from hospital to say that I'm there, but they won't let me see him. They put me in a different room and they've surrounded me and they wouldn't let me see my husband. Please come quick. I saw there were curtains drawn. Something's happened. I said, don't worry, Auntie Mum, I'm on my way. I'm on my way. I'll be there in a few minutes. Don't worry. I got to the hospital. I stormed straight past the reception. I went to where his bed was, bed 4, and the curtain was drawn. And and there was a nurse standing outside, and I was going up to his bed, and she put her hands up and she said, you can't go in. I said, that's my father in there. I want to see my father. She said, no, you have to go to reception. I said, you need to move out of my way right now. I want to see my dad. I put the curtain back. She moved out of my way, and there were 2 nurses there. I said, Dad, what's the matter, Dad? He's lying there. I put my hand on his head and he's still hot, and he's put my hand on his hands and he's still warm. And I'm saying, Daddy, I'm here now. Please wake up, Daddy. I'm here. I'm here, Daddy. I'm here for you. Please wake up. And the nurses are changing his stoma bag and changing his bed sheets, and I've asked this nurse, what's happened to my daddy? Why isn't he replying? Oh, sorry, sir, we can't tell you what's happened. You have to go and speak to reception. I said, no, I'm asking you. I want you to tell me what's happened to my daddy. And she said, sorry, we can't tell you. And the nurse on the other side, he was Sam, from the one who settled him in. He said, I looked at him. I said, my dad. He said, he's no more. I said, is he gone? He went, I pushed him away. I said, Dad, wake up, Dad. I'm here, Dad. I'm here. Wake up. Wake up, Dad. I'm here. I'm here for you, Dad. Sorry I couldn't come to see you yesterday. They wouldn't let me see you. I'm here, Dad, for you, Dad. Please wake up. He wouldn't wake up. And then I said to him, where's my mum that she came to see him? You didn't let her see him. Where is she? They said she's at reception. I stormed to reception. Everyone's laughing and giggling away.